Welcome to part 4 of our 6-part training series on respiratory protection. In this section, we'll cover medical clearance. We'd like to thank the following institutions and individuals. Now that we have covered the basics of respiratory protection, we can delve into medical clearance. Some of the slides in this presentation are very detailed, and you are welcome to pause the recording at any time to review the slides in more depth. By the end of this module, we hope that you'll be able to explain why medical clearance is necessary, list 3 questions that may be part of a medical evaluation, and describe the possible outcomes. Medical evaluation is needed to make sure that the respirator will not harm the healthcare worker. Respirator use may not be safe for workers with certain health conditions, like cardiopulmonary diseases or claustrophobia. The medical evaluation includes a questionnaire and a brief physical exam performed by a physician. The accompanying handout for this module contains these questions and a suggested form for the exam and results. A written recommendation of medical clearance states whether or not the worker can wear the respirator and whether there are any restrictions. In some cases, medical follow-up may be recommended. This is a list of general health questions that may be asked in a medical evaluation. The answers to these questions should be confidential. You can see that the questions about lung symptoms are very comprehensive and are related to various activities. Heart problems, like high blood pressure and history of stroke, are also important to assess. It's also important for the evaluator to ask about any medications and any past experience with respirators. These questions are important for users of full-face respirators, since full-face respirators may cause additional problems for the wearer. Respirator users may need to be re-evaluated if they experience any difficulties. The physician should assess whether the healthcare worker can safely wear a respirator, can wear a respirator with certain restrictions, or cannot wear a respirator. This result is sent to the supervisor. It is the only information provided to the supervisor. Other information is confidential. In summary, workers cannot be fit tested until they obtain medical clearance. The standard medical evaluation is a questionnaire, vital signs, and a brief cardiopulmonary exam. It asks questions about past medical history, smoking status, and current medications. Lastly, healthcare workers may be cleared to wear a respirator, not approved to wear a respirator, or approved to wear a respirator with certain limitations. Their underlying health conditions must remain confidential, regardless of the outcome. Here is a sample questionnaire provided by OSHA. We have also provided you with a questionnaire in the accompanying handout.